You're watching Inside Utah Politics.
Time now to debate some of the big stories of the week with the Inside Utah Politics panel. This week we have State Representative Suzanne Harrison and former House Speaker Greg Hughes. Great to have both of you on the show. Thanks for being here.
Thank you.
Thank you.
All right, let's get right to one of the big stories of the week, and that is our daily rolling average, 7-day average of COVID-19 cases. We're seeing this second wave, as far as confirmed numbers are concerned, much higher than the first wave. We have hit over 1,000 on the daily average for the first time, that 7-day average. Former Speaker Hughes, let's start with you. What do you make of that?
So that average matters because what you don't want to see happen is you have a highly contagious virus. Those that are vulnerable, that might find themselves in a hospital or more critically in an ICU bed, intensive care unit bed, we have only so many beds, and that capacity, if full, if you saw what happened to Italy during the beginning part of the year, we cannot see our hospitals overrun. But this is the part, and this is the thing that I think 9 months later after January when we saw some of these things, you have to stare at that capacity of your intensive care unit beds. I think as important as what your infection rate is for a virus that we don't have an immunity against, we have to see what that hospital capacity looks like, and that's what you have to stand guard and watch. And I'm not seeing commensurately the number of cases as we're seeing this. Some people don't really feel it as much, but they're getting tested. If we're not seeing the overrun inside of those hospitals and in those intensive care unit beds, then I want us to be very cautious. I'm hoping we'll be cautious not to destroy our economy or interrupt our children's critical opportunities for education, public education, things like that. And even the hospitals being empty and not being able to get other critical care that we need. I think you have to measure not just infection rates. That can't be the end-all be-all. It is really what is its impact on our healthcare delivery.
Okay, but what we see is when we start to see numbers go up, the hospitalizations tend to lag about 2 weeks or so. Representative Harrison, that's something you see on the front lines. Give us an idea of what you're seeing.
You know, in my day job, I'm a medical doctor on the front lines, and actually today I was in a COVID ICU here in the Valley, and they are full, and I talked to nurses and doctors that are exhausted. You know, I think we have to keep in mind that an ICU bed doesn't take care of patients. It's those trained experts and health professionals that take care of patients. And what I heard today and what I'm hearing across the board is that people on our front lines are exhausted. And I think this escalating number of cases that does create subsequent increase in hospitalizations has to be a call to action on all of us to redouble our efforts and make sure that we're contributing to the solution and helping make sure through choices of our own in terms of wearing masks and washing your hands and staying physically distant, that we're helping keep our neighbors safe. We've been doing this a long time, and I get it that everyone is frustrated and tired, but we have to tackle this together. And I really hope that people will look out for their neighbor by doing these simple things, because our hospital systems are strained and stressed.
Let's get a little more into that, because there's clear data that this is being driven by the younger population, a population that isn't impacted the same way as the older population by this virus. When we talk about solutions, Greg, where do we go?
So I would never counter what Dr. Harrison's saying in terms of the ICUs that she's visiting and what she's seeing there, but I do think it's important for Utahns to know our ICU bed capacity is not overrun when we are not full. We may be in a respective ICU unit at a respective hospital, but certainly our capacity is there. We are not even close to reaching in excess of that capacity. But we also have smart hospitals that are preparing for or contemplating expanding capacity if we ever got to that moment. So when we look at that, I think that is something that we can't ignore. If we are worried, if we think that there's not going to be infection rates at all, as you've pointed out, we have younger populations that don't feel the symptoms the same. A comorbidity rate, which is a fancy word of saying you may have other underlying health issues. They say, CDC saying it's 2.6, so more than 2 other health-related issues that compound getting this virus and finding your way to a hospital. We have young people that aren't feeling it maybe the same way. We have elderly people that certainly do.
Okay, let's focus
so I think you got to be critical about how you're protecting people or how you're making sure the right people are being not exposed to this virus and having access to health care.
Let's focus on that, though. The younger people, the ones that aren't going to be impacted the same way, could they be acting more responsibly?
Certainly. Well, look, I think anytime you're going to bring people together, we could all stay inside from now until, I don't know, the virus, a vaccine shows up or something happens. The day you get outside or get around people, if you're not taking any precautions or you're not, then you are going to see these cases go up. There's a 99% recovery rate if you do get COVID-19. I think this is with us for some time. I think we have to be taking precautions and being smarter. And I do think that young people, my daughter, she's 21 years old, and we have this conversation. I know a lot of families are having this now. You have to take precautions you might not have taken in the past. That is certainly the case. But what I don't want people to think is that this is any more critical or less critical. Look, you can't let these kids not go to school. We cannot interrupt education. If we think that every child has a stay-at-home parent and that this is just going to work seamlessly, it's not. It is going to have its impact. If you have other issues or needs in a hospital, you can't be turned away for cancer treatments or other things. There are other issues, health-related issues in a healthcare strategy that you can't ignore at the same time we're staring at this virus and its infection rate. So we got to ask young people to take precautions, be stronger in that area, but let's not overblow it or let panic seep in. That's
Representative
the last thing.
Harrison, let's bring you in on that. You have kids that go to the same school I do, the same school the speaker, former speaker does. Right now, our children are learning online only because of what happened at the high school. What about the other consequences outside of this?
You know what? We do need to work together to get kids back in class. It is critical. There's no substitute for an amazing teacher in the classroom with kids learning in the classroom. But again, we've got to take personal responsibility and do our part to help quell this virus. You know what? I think it's a misnomer and misinformation that this virus is only impacting older folks. The average age of hospitalization in this state is 53 years old. That means just as many people are younger and just as many people are older. We have got to be realistic that we don't understand fully this virus. We know it impacts some in a devastating way, and even, people are dying. And something as simple as wearing a mask when you're going to the grocery store can save lives. And I call on the Utahns that I know and love, that love their neighbors, to help be part of the solution. We've done a great job in Utah of not shutting things down. We've not been extreme. But our numbers ticking up and our deaths ticking up need to be a call to action and vigilance to continue to do your part to help save lives here in Utah.
We could go on this for quite a while, and I wish we had more time, but I want to hit on a couple other topics while I have you here and while we have the time. State Auditor John Dougal putting out his audit on the state response. This is something the both of you are really hitting heavy on for months now. So we've had a chance to look at his audit, and he came up with a lot of the same things I've heard come from the two of you. So in 30 seconds each, tell me what your assessment is of the audit from John Dougal. Greg, let's start with you.
Look, I laugh because 30 seconds to talk about such a complex issue, for me especially, that's pretty hard. I would just say this: a state of emergency, and when you're asking your state officials to act while time is of the essence, we have statutes that contemplate those moments. What we are living through right now doesn't match those moments of earthquakes, fires, wildfires, floods, and there is much to learn from what actions the state took and avoiding out procurement processes, not using some of the statutory processes we've set up when we spend taxpayer money. What this audit shows is that in many cases, the state did what it needed to do in terms of being under the gun and seeing that they needed the personal protection equipment, things like that. But what we can take from this, and I'm a former speaker, I'm not a speaker now, but what I would say to my former colleagues is that it is time to revisit the statute for a state of emergency and what qualifies for that, and what circumstances the executive branch can summarily just say, we're not going to look at we can throw out any statute we want, whenever we want. We're going to have to stare at that given the times that we're in. We have health departments as well, where their orders, without even a state of emergency, have the effect of penalty of civil law as well as criminal law, whatever that order may be. I think it's time to stare at that process as well, make sure we're getting that right. I think this audit, hindsight's 20/20, but there's a lot that we can identify and learn from. Hey, I think we love emergency preparedness as a culture. We like to be prepared. I think what this audit says ultimately is we got to be better prepared.
Okay, Representative Harrison, something you've always talked about, the audit confirming insufficient planning, no clear chain of command early on. Your thoughts?
I agree with a lot of what Greg already said, and I think we want our government to be responsive and nimble in any type of emergency, but we also owe it to taxpayers to be transparent and accountable with every tax dollar. And I think it's critical that we look at mistakes made and learn from them and adjust statute accordingly so that every tax dollar is spent in a way that truly helps Utah families and is spent in a way that gives every company a fair shake at having an opportunity to participate in the solutions and contracts. It needs to be an open process and a fair shake.
Okay, we are going to have to end it on that note. I wanted to get to more, but great conversation. Appreciate having both of you with us. Thanks for being here.
Thank
We'll be right
you.
back after the break. Stay with us.